I believe this voice finds you well, and I also know that you're enjoying your evening. Thank you so much for watching Family TV. Of course, I know you've been watching us throughout the entire week. You've watched this television since morning. Thank you so much. Actually, what you're doing is the best, and all we can say is thank you, thank you, thank you. This is Health Pot. Remember, this program is brought to you by Makerere University School of Public Health, together with Family TV. You shouldn't miss it. You shouldn't miss any single session of this program, because whatever is talked about here is so important. Remember, we are looking at maternal health and early childhood development. So you shouldn't miss. And Edrine Osteen Mukalazi is my name, together with Fatna, Garenda, our sign language specialist. And today we have Dr. Sam Ononge, who is going to take us through today's topic. Doctor, you're most welcome to HealthPort.
Thank you, Edrine.
Kindly greet our esteemed viewers.
Thank you, Edrine, for inviting me, and good evening, viewers. And I'm delighted to be here, and it's a joy for me to participate in HealthPort. Thank you.
We are indeed grateful, Professor, and maybe these people need to know where you come from, because I understand you come from Makerere School of Public Health, but they don't know which department you're in.
Edwin, thank you so much. I first want to correct, I'm not a professor, but I'm in the line to becoming what? Becoming a
almost
professor.
There.
I'm a trained doctor. I'm a gynecologist, and I work in the School of Medicine, Department of Obstetrics and Gynecology. That department basically means where we take care of pregnant women, time of delivery and after delivery, and those who have challenges with problems of conceiving. And that's what basically I work in. And I also teach in the medical school, and my employer is Makerere University. Thank you.
Well, we are grateful, Doctor. So now that Doctor has told us that he works in the Department of Obstetrics and Gynecology, today we want to look at what we call excessive bleeding after childbirth. Doctor, what do you have to talk about this excessive bleeding after childbirth?
Edrine, this is a very important area in the life of a woman. From the time she conceives, she prepares to have a normal delivery, and then after that to take care of her child after. However, along the course of pregnancy, and then there may be some challenges. But after delivery, she can bleed excessively. And bleeding excessively is a really big problem, not only in Uganda here, but also globally. So normally, every woman who delivers has to lose some blood a bit. But when it is excessive, that becomes really a problem.
Maybe you've said, Doctor, that it is a very big problem, not only in Uganda, but globally. But how big is this problem specifically to Uganda?
Uganda. Now, out of 1,900,000 women who conceive and then carry the pregnancy up to the time of delivering a live baby, you find that about 9% of them, that's 9 out of 100, experience excessive bleeding after childbirth. And those 9%, if you took a figure of 1.9 million, that's a big number for our setting here. But you find that also those 9% are at a very high risk of losing their life. If you compare it with other conditions, you find that our figures for the women who die because of complications of childbirth, excessive bleeding after childbirth takes about 4 of those who die as a complication of childbirth. That's about 39% of them lose their lives if you experience excessive bleeding after childbirth. So it is a big problem countrywide. It's the leading cause of maternal mortality of women dying as a result of childbirth. And it has been like this for a number of years. It is not coming down. It's even actually basically stagnating. It's not coming down. And it is something which is disturbing us who work in the field, but even for the ministry, it is a concern that excessive bleeding is taking a lot of lives of women.
So, doctor, you told us that it is normal for every mother giving birth to lose some blood. Why is it important for a mother to lose this blood?
Okay. Now, it is naturally after the delivery of the baby, the uterus has been containing this sac of water together with the baby, which is about like 500 liters altogether. Now, when the baby comes out, where it has been attached together, basically comes together after the baby has come out. That area is a raw area which some blood has to ooze. Some little blood has to ooze, continue oozing slowly. And women will tell you, yes, they are losing some blood, but it should not be so much. Naturally, we say that if you lose, for example, a tampeko is 500 mils. That's the danger. That's the danger. And some people, the tampeko, it may be very difficult for you to measure how much blood comes out. But if you lose like this fist, 2 of them, that means your blood actually a lot. Now, in some situations, you find that you're not even able to measure that whether this is a tampeko or this is 2 fists. Some people say, if this woman's condition worsens, after delivery like this, she has pushed the baby and some blood is coming, and even if it is less than 1 fist, and that bleeding makes the woman's condition deteriorate, that is excessive bleeding for that woman. Because some women basically reach the time of delivery when their blood level in the blood is still low. So even if they lost very little, that is excessive bleeding and tilts her downhill. And if it is not stopped, it can easily affect.
In other words, the excessive bleeding also depends on the level of blood that the mother is containing.
Yes, it depends on how much blood is she before the time of delivery. Because, during the 9 months, we give certain things for this woman so that she prepares that at the time of delivery, she has adequate amount of blood. So that even if she loses like 1 tampeko, she's still strong. But if already you find that she's already anemic, the blood is low, she's already pale, she's weak, even if she loses like 300 mils or half a tampeko, that makes us conclude that this woman has bled excessively and she can easily take her life.
So, doctor, we shall also talk about, because you told us that this is a risk problem that actually causes very many mothers to lose their lives after giving birth. What are some of the other causes of deaths?
Yes, apart from excessive bleeding, now we experiencing women who have high blood pressure. The high blood pressure basically increases during pregnancy, and she can easily, apart from only the blood pressure increasing high, she can convulse, have a fit. And when she feeds, that is basically dangerous, she can easily die. And high blood pressure affects very many other organs, the kidneys, the liver, and also affects the baby's health also. Abortion is another complication, which is causes women to die. And the other one is that some women after delivery or after abortion can get infection. They get septic. They get septic, pus coming from down, and all the organs basically get affected. And then low blood generally. Women who are anemic with malaria is a big factor which can cause basically women to die. But the major one is bleeding, excessive bleeding after childbirth, and followed by high blood pressure in pregnancy is the two leading causes of women to die in our setting currently now.
Okay. So, still, doctor, I will ask because you talked about women and bleeding a lot and all that, and you've also told us when a woman realizes that this is now excessive bleeding. But what causes this bleeding?
Yes, excessive bleeding after childbirth is good. Thank you, Edrine, for bringing that question. There's four major categories of causing a woman to lose blood excessively. One is this uterus has been so big, containing about 5 liters of fluid inside. Now, naturally, after the baby has been pushed out and all the water, all the products have come out, that uterus is supposed to come back harder and smaller. And that naturally helps the bleeding to stop. Now, in some situations, you find that uterus fails to contract. If you take like a uterus which was initially containing up to the level of the cephisternum, and is supposed to go below the umbilicus, but remains bigger, that uterus is still open. And the blood vessels easily are attached there, push blood through that porous area. But if the uterus contracted, you find that the blood basically is stopped from oozing. So one major factor which is the leading cause of excessive bleeding is failure of the uterus to contract. The other one is that during the course of pushing the baby out, the woman might experience some tears in the birth canal, and some tears are small, some tears are big. They can easily cause torrential bleeding. And the other factor is you find that instead of you expelling everything, the baby has come out, maybe the placenta has refused to come out, what we call the retained placenta or retained products. That one also can cause, because that makes the uterus fail basically to contract, and you get excessive bleeding. And then we have a category of women where you find that they have generally a bleeding problem. When they even get a cut here, the blood just flows continuously. Naturally, you and me, when you get a cut, some blood comes and you form a clot there. But some people, it just continues flowing. So you find the blood continues flowing, and that causes you to have excessive bleeding. Each one of these has different risk factors. What causes the uterus fail to contract is very key.
I think actually, Dr. let us directly go to that. What causes this?
Yes, it is the leading cause of excessive bleeding, failure of the uterus to contract. And if you take all women who experience excessive bleeding, out of 10 women, about 7 or 8 is failure of the uterus to contract.
That is a very big number.
It's a very big number. And one of the risk factors or the producing factors to that is if you had like twins, causes the uterus fail to contract, and sometimes either you have excessive water that stretches the uterus so much that even when it is going to contract, it doesn't contract to a very good level, which is hard like a stone to stop the bleeding. That is one. The others where you find that the time you take from the time you started having labor pains to time to delivery is very long. For example, normally we say a sun should not set twice when you are having labor pains before the baby comes out. That is long labor. But you even shorten it down that a woman who was having the first pregnancy should deliver within 12 hours. But if she delivers more than 12 hours, that labor has been long. So prolonged labor is a risk factor for your uterus basically to do what? Failure for it to contract. There are some drugs which are used in the hospitals.
So maybe, Doctor, I request that let us first take off this message, and then when we come back, we shall start from there. Yeah, we are coming back after the commercial break, and then we shall continue.